שבאתם. קוראים לי חגי ברגמן. אני נמצא הרבה שנים באוניברסיטה העברית, בפקולטה בעין כרם, ואני מנסה במשך כל הזמן שאני נמצא שם, לנסות להבין אזורים מסוימים של המוח, והגישה שאני מייצג זה הגישה שבאה ואומרת שבעצם המוח שלכם זה המחשב הטוב ביותר שיש לנו בעולם, ואם נבין אותו יותר טוב, אז אולי נוכל לעזור יותר טוב לאנשים שיש להם בעיות, אולי נוכל לעזור יותר טוב לעצמנו, וזאת הגישה שאני מייצג. אני מנחש שאתם ממקומות שונים במדעי הרוח, נכון? זאת אומרת, זה פחות או יותר. והנחת בחברה, אוקיי. אני אפילו לא יודע כל כך את ההבדל. והנחת האפס היא שאתם לא יודעים כלום על מה שאני הולך להגיד, ושזה בעצם לא נורא חשוב, אוקיי? אז תרגישו חופשי להפסיק באמצע, להתווכח, אוקיי? זה לא... אני בטח לא אכתוב שאלות למבחן, או לא... יש מבחן על הדבר המטופש הזה? אוקיי. אז זהו. אם אתם רוצים קצת יותר... אין פה את הוובסייט שלי, אבל הוובסייט נמצא תחפשו באזל גנגליה באוניברסיטה העברית, אז תמצאו אותי. אני מתנצל שהשקפים יהיו באנגלית, אני פשוט רגיל להגיד. אני עבדתי עם... השיעור יהיה באנגלית? No problem. כן, כן. אוקיי, sorry. I'll switch. I was not aware that I should speak in English. I will try to do it. It will be a kind of Ibrish, but a kind of. So most of the work that I was doing is done in collaboration with many, many people, and just many thanks to all of them. I will start with a very, very simple question that I think that people in this mount should be able to answer better than people in my campus or in the Givat Ram campus. What is the goal of your life? Very simple, okay? I think that, okay, everybody here is adult, okay? So you decide, you are in the university, it is your decision. The decision to take this course or to take everything was your decision. I'm assuming that, of course, you are doing every time small decisions like, should I go to the cafeteria, should I go to the restroom, and so on and so on. This is small decision. But you've done big decision in your life, okay? For example, going to university, going to study this and not medicine or not mathematics, okay? And I would like to believe that such kind of big decision were influenced by the goal of your life, okay? So probably, after you've done such major decision, you know what are the goal of your life. Silence? Huh? It's very personal, I agree, but, well, it could be, okay. This is one. Actually, your answer is, yes, I have goals, but I don't like to expose it. Okay. I have a different answer, so therefore I'm pushing to it, okay? I will not push anymore, okay? But you know the goal of your life? Yes. Okay, go ahead. Happiness. Okay, and for happiness, you are here in your coming to the university for happiness?
Maybe through self, yeah.
But are you not happy just by having going to a pub? So why going to the university? Go directly to pub, or go to the beach, or do whatever make you usually more happy than spending time in Mount Scopus. It's then happiness. So the goal is self-fulfillment or happiness?
Self-fulfillment leads to happiness. There are a lot.
No. Okay, but I'm asking about the final goal of your life, okay? And then we'll say, okay, to arrive to...
One thing leads to another.
Yeah, I agree, okay? I understand the logic. But what I'm trying to actually cause you to think about is, okay, we know that there is one thing that leads to another, and so on and so on, and we are on the way. What I'm trying to actually to face you is the fact that usually you have never, or most of you have never think about the goal of your life, okay? You are busy in these small steps that might lead you to some final pathway that you are not sure, okay, because it is so vague, okay? And you think, okay, maybe if I will go this pathway, at the end I will find what is the goal of my life, okay? But what I'm trying to say, no, you came to the university, okay? You should think about this before, okay? I'm not sure that you'll be happy with my answer, okay? And maybe at the end of this talk, of course, you might argue with my answer, and you might say that you have a different goal of your life. But in any case, what I'm trying to say that it is important to think about it. And you cannot give me an answer that, okay, I'm doing this in order to do this, in order to do this, because what I'm asking now, what is the real goal of your life? I understand that there will be steps, okay? And I'm leaving it open because I'm going to, again, actually, of course, I'm not the first one to ask it. Know yourself, it is a very old theme in philosophy, and actually I think that this is what I'm asking now, okay? Know yourself. What is the goal of your life? And I think that as it was true 2,500 years ago, it is true today that adult, educated, smart people should think about it and not only behave day after day, okay? And the answer that I'm going to give you, okay, that I hope that it will offend you and you'll not agree with it, okay, but this is my answer, is that the goal of your life, like the goal of every biological creature, is to move forward as many genes of yourself to the next generation, okay? This is the goal of biology, okay? This is the goal of biology. Every biological creature, and we are biological creature, again, unless you believe that there is something in the sky somewhere between Venus and Mars that is located in a small balloon and is giving you instruction and such thing. But if you don't believe that there are other forces than natural forces, then we believe usually today that our biological life were shaped by the evolution and by the evolution rules, okay? And the rule of the evolution are dictated by this rule that say, move as many genes to the next generation, okay? And again, I think that as part of general education, I would strongly recommend the book of Richard Dawkins, The Selfish Gene, okay? Another book much later is The God Delusion, that also I recommend very well, that I'm related to. But the point is that the issue in the selfish gene is the point that actually it could be that we are the vehicle that the gene are used in order to move from one generation to the next generation, okay? So we can argue who is more important, we are or the gene, but what I'm trying to say that the goal of every biological creature, okay? And if we accept that we are part of biology, is to follow the evolution rule. And the evolution, the major rule in the evolution is to forward as many genes to the next generation.
And how can we explain people in society, like nuns and monks who don't get married?
I will come to it, but again, this is a nice feature of biology and all physical rules that we have a very big Gaussian. And of course, there are exceptions. Okay, so we can find exception, and we can say, but let's say that now I'm not speaking about everybody in biology. I'm speaking about 99.9. Okay, and I agree that there are exceptions. Okay, and I can explain even this kind of expression, but at this moment I think it is redundant. Okay, so. So having said that your goal in life, like all creatures in biology, is to move your gene as much as possible of your gene to the next generation, then clearly what you have to do, okay? What you have to do is to get food, water, and shelter from extreme temperature, okay? This is the first thing, okay? To avoid danger, okay? So lion, boring seminar, and so on, okay? But I mean really danger, because if you will go outside to the street and a lion will eat you, or then you will not move any gene to the next generation, okay? So clearly you need to have food, water, and shelter from extreme temperature. You need to avoid danger, all form of danger. And finally, you have to find a sexual partner, okay? And indeed, look all around, not you, of course, you are perfect, but look around over your friends and so on and so on, and you'll see that these are the three major things that are engaged in life, okay? And so this is very, very clear. This is the goal. For this goal, we have to do this, okay? And this is the controlling part of our behavior. And still we are having problem, okay? Because we, yeah.
Before you go on, just 2 points that I thought about in
biology tactics.
Get food, water, and shelter. I immediately thought about psychopathologies like anorexia that goes the other way, and find sexual partner. I immediately thought about these raging feminists that don't want to marry, don't want to have children, which is not a psychopathology as much as I know, as far as I know. And there exist people that don't want to have children.
So actually,
it's not the goal of their life, and it's not the goal.
So actually, you're repeating the question before, but it was about monks. Okay, what about monks? Okay, monks, Nizirim, people.
Monks.
Okay, I say that I'm going to. I'm Hebrewish speaking. Okay, and my answer to this question is, which is exactly the same answer to you, is that we are speaking about biology, okay, and we are speaking about the vast majority of the people. And I agree that it could be that there are exceptions, because this is the nice feature of biology. It has a very big standard deviation. It is Gaussian distribution. It has a very big, and we can see exception, okay, to the big rule. But the rule is there, okay? And then you might ask me how it could be that there are exceptions, and I can give you answer to it. But at this point of time, I would say, okay, I'm not speaking about everybody. As I said, I'm not speaking about you, because I'm sure that you are not interested in food, water, sexual partner, and so on. I'm sure that this is not of your interest, and you are only interested in understanding the brain and the big philosophy behind, of course. But all your friends are like that, okay? So, let's speak about the vast majority, okay? And therefore, I'm speaking about these three tactics. And what I would like to say is that even giving these three tactical goal, we still have problem. And the major problem is exactly the problem that I think that most of you are facing this day at your age, okay? How I optimize the selection of my sexual partner, okay? The selection, we in our society, we don't have lion, we don't have, usually we don't miss food and water, but still, I think that the major problem is how we optimize the selection of sexual partner, and the point that is written is actually, how do I avoid local minima? How do I avoid the situation that the first sexual partner that I find is I'm staying forever, okay? And it could be that this sexual partner is not the optimal one in order to forward my gene to the next generation, okay? So clearly, we have the goal of finding sexual partner, okay? And of course, it is also related to food and so on, but not in our society, in more classical society, okay? It's related to the other problem, okay? But I'm speaking about you, okay, that I don't think that you have problem with food and with shelter from extreme temperature and with lion in the street, okay? But still you are facing the problem, this problem, okay, in our society all the time, is how can you optimize your behavior in order to avoid situations that you pick up the first choice in your life that might be not the optimal choice for the future, okay? And we said how we do the trade-off, how we can trade off between short negative outcome, okay? Which actually I think that you are doing now, okay? You are coming to the university, okay? So clearly sitting in most lecture in the university is negative outcome. You can enjoy something much better outside. But most of you think, and again, I'm not coming now to the goal of life, I will finish university, then after I will be able to do whatever I would like to do. I will be able to change the world, I will be able to do something. So you trade off the short negative immediate outcome for far away positive cumulative outcome. And how can we do it? Because if our behavior is controlled by this need, we should find the first solution that give us, okay? And how we can do the trick and still fulfilling the real biology goal, which is to forward as much as possible gene to the future. Okay, so this is the question that I'm going to ask you, or I'm going to speak about it. And in order to be not as invasive as I started, okay, I'll stop speaking about you, and I'll start speaking about the Pac-Man, okay? So this was my kid generation, okay? I think that, but probably you are aware with modern version of it, okay? So this Pac-Man is living in this world, okay? Here is the Pac-Man. He can go to the right, to the left, and so on and so on. He has food, okay? This is regular food. This is much better food, okay? The red one, okay? And there are monsters, okay? That can either take him points or can kill him, okay? And he should find his best way inside this maze, okay? In order to maximize the number of points that we'll get by the food and to minimize the number of penalties that we'll get by meeting the monster, okay? Pac-Man. And the question that I'm asking actually, now the Pac-Man is sitting over here, okay? Clearly, he's looking to, he cannot go up and down, okay? He can go either to the right, either to the left, okay? If you go to the right, you'll have point over here, okay? So you might think, if you'll be Pac-Man, you'll say, clearly it's better to go to the right than to the left, because over here there is no food, okay? But actually you see that if you'll go to the left, at the beginning, in the first move you'll get nothing, but then at the end, you'll get to the red point, which is much bigger, okay? So the question that I'm asking now, how can I teach my Pac-Man to optimize his behavior, to trade off short negative income in order to maximize far forward or future cumulative income? So actually, we are coming now to this is a real question that we, in the field that we call it today machine learning, artificial intelligence in the past, we are really facing it. And from our point of view, usually we say, okay, this is the Pac-Man. The Pac-Man is located in a certain state, okay? The state for now is the location of the Pac-Man. If you know what is to the right, to the left, if you know where the monster is memory, this is the current state of the Pac-Man. He can make different moves to the right, to the left, up, down, okay? So he has the choice to go to this lecture, to go to another lecture, to learn mathematics, or to learn biology, or to learn philosophy, okay? He selected one of them, okay? Selected one of them, and then he got reward, okay? And keep in mind that now in the simplified way that I'm speaking, this reward can be positive or negative, okay? Positive, food. Negative, meeting a monster, okay? So it is the same domain, okay? For me, negative, if I meet monster, I lose point. It is something that sometimes I'm ready to pay it, okay? Hopefully the monster will not kill me. It will only take me points, okay? But I am ready to do it. So reward can be positive or negative. So I'm getting reward, and I move to a new state. And in this new state, again, I have the several choice, and I select one, get reward, new state, and so on and so on. So this is a serial way to look at it. But Actually, we can say that it is a very circular way. We call our agent, our Pacman, in artificial intelligence, it is the agent, and it is always she, okay, to be politically correct. So the agent is doing an action on the word, okay? And as a result of this action, the word gives the agent back the new state and the reward. And again, okay? So this linear scheme is eventually a circular form that the agent is doing an action on the word, and the word gives back the new state and the reward. And the goal of the Pacman, which between only the two of us, we know that actually I'm speaking about you and not about the Pacman, okay? But now I'm thinking about the Pacman. The goal is to maximize future sum of positive and negative reward, okay? This is the goal of the Pacman, okay? And the problem that the Pacman is facing is exactly the problem that you are facing. First of all, the environment is noisy, okay? That is, the fact that there was food or a monster in this point 2 days ago does not tell you that there is still a monster in this point. Maybe the monster moved to another place, okay? The monster can move, okay? Or maybe I already ate the food and the food do not grow again after I ate him. So the environment is noisy. It is not enough that the environment is noisy. It is that even the rule of the environment can change, okay? So for example, you move to the next stage in the Pacman, okay? Now the monsters are really speedy, okay? They can jump above the wall, where in the first stage they were unable to jump. So the rules are changing, okay? And nobody, at least in our world, as you may see, but by the last trial of the president and so on, tell us that the rules have been changed, okay? So the rules are changing, okay, and we are not aware, okay? It is not that it is not enough that we can say, yes, there are rules of the world, okay, and I understand the dynamic, okay, and still it is not clear to me over what is the situation. It is worse than this because the rule can change all the time. The feedback that we are getting from the world is not instructive, okay? That is, if the Pacman decide to go to the right, to the left, he get point. He get positive point or negative point. But no one tell the Pacman or us this was the correct move to do, okay? Because, and therefore, all information that we are getting from the world is depend on our exploration, okay? If the Pacman will never go to the left lower point of the world, you will never know if there are monsters over there or very, very good food over there. If you will never go to learn mathematics, okay, you will never know if it is good for you or bad for you, okay? So all the information that you are getting from the world is depend on your exploration. Moreover, so this is the fact that there is no teacher that tell us, and therefore it is depend on the action taken. The feedback that we are getting is really, excuse me, is really not complete. And the point that the feedback is not, to understand that the feedback is not complete is that we don't know if there is a maximum or minimum to our pleasure or to our sorrow, okay? And the point is that let's say that it is unbelievable. You are really enjoying this time now, okay? It was good, really unbelievable. First time in the university, you are happy. Still, you are not sure that this is the maximal happiness that you can have. And you still have the doubt it could be that in another room there is much, much better talk, okay? So you never can be satisfied, okay? Because if there was a maximal, you know what is my maximal happiness, okay? Then you are done, okay? Let's say that now you reach the maximum of happiness, then you know that it could not be better at the other places. But you don't know, okay? So it's never enough. And finally, you never know what you have done. The feedback is delayed, okay? The Pacman decided to go to the direction northwest, okay? After 10 moves, he reached the the monster nest, okay? When was the mistake? Now, 3 years ago when you decided to go to the university, 7 years ago when you have gone to high school, when was the mistake that led you to the really abnormal situation that you have to face me and to think about the goal of life, okay? So we call it the credit assignment problem. And the way that we, in machine learning, computer science, solve this problem, okay, is by a new method that we call it bootstrap computing. And the issue with bootstrap computing is exactly like the, I don't know how to say Baron Münchhausen, how to say it in proper English. Someone? Okay. This man, I have my limits of H and A, okay, even in Hebrew. And this Baron was going in the, of course, according to the story, he was going in the, between cities in Europe and suddenly found himself in a pond of mud and was sinking down and no one was over there to help him. And he was looking around, there was no one to help him, so he has no other way but took his bootstrap, okay, the Soreq line, and pull himself outside of the mud, okay? And this is our problem, okay? We have no one that will help us, okay? We have to learn alone, okay? And the way that we can learn alone is actually by all the time using the mismatch between our prediction and reality. So let's say that we start tabula rasa. We start with no information about the world, okay? At that time, actually, our prediction will be that all actions are the same, okay? All action will give us the same reward. If I will go to philosophy, I will go to mathematics, I will get the same reward, okay? But then, so this is our initial prediction. Then we are doing something, going to the right, going to the left. And either we get positive point or negative point. If we get positive point, then reality was a little bit better than prediction. So we reinforce this behavior, and next time when we'll come to this decision, right or left, okay, we'll go more to the right. Of course, if we'll get negative point, we'll meet the monster. Next time that we'll come to this decision, we'll go less to this point, okay? So we adjust all the time by exploring, by moving in the world and comparing our prediction to the reality. We adjust our understanding and our estimate of the real value of the state, okay? We adjust our behavioral policy, because what is behavioral policy? It is very, very simple. Behavioral policy is the saying, if I am in state A in a class, I'm doing action B, sleeping, okay? If I'm in other state, I'm doing, and so on and so on. This is behavioral policy, okay? So this is what we are doing all the time by exploring, by moving in the world, and all the time comparing reality to our prediction. We call it the temporal difference error, because it is now you are a little bit more clever than you've been 10 minutes ago. You know that next time that someone is coming from in Karem, you will never come to such a talk, okay? So you are a little bit, now after temporal difference, you can compare the prediction that you have 10 minutes ago to the reality now, and you all the time move according to it, and you can use this trick in real life in order to overcome and to learn with non-instructive delay and incomplete feedback, okay? And this is done, okay? So if you, I knew once how to say sheshbesh in English, but, okay? So if you play sheshbesh, if everybody know, because sheshbesh is much better. So if never play sheshbesh in the virtual, on the web, because the program in the web for sheshbesh were reconstructed using reinforcement learning algorithm, and now they beat the world champion, okay? It is not correct yet for chess, okay? But for sheshbesh is correct, okay? And therefore, it is really amazing. And moreover, of course, we need to do it, okay, because if we send sometime a satellite to very far away stars, okay? We don't want that every time that they will face a problem, they will stop, we'll send the message back, wait for our answer. We need devices that are smart enough to know their goal, to behave in the environment, and to fulfill their goal according to the problem of the environment. And this is working. This is something that people in computer science learn and are very, very happy with this. And the question that I'm asking now is, can we in biology have similar things? Okay, so this was Pac-Man. Okay, but now coming back to us. Okay, as I said, all the problems of the Pac-Man are really our problem. You don't have a teacher that you really trust for everything to give you instructive knowledge. Okay, I hope so. Okay. And part of your behavior is depend on your exploration, and you don't have any a priori information about the environment. So you have to find your way in a very, very similar way to the way that I described to the Pac-Man. And the question is, do we use the same trick of bootstrap learning in our biology? And of course, you may guess that my answer is yes, indeed. We have the same trick. And we start with the activity of dopamine neuron. So in the brain, okay, the brain is very, very big, and there are very many neurons or cells in the brain. A small cluster of the neurons in the brain are those neurons that manufacture a neurotransmitter called dopamine. So I call them dopaminergic neurons. And we can record the electrical activity of this neuron that is like computer bits that are going up and down. And we can do it while we are training a monkey to do a very, very simple behavioral task. The monkey is pressing a central key, okay? Then a cue appears either on the right or the left, okay? And then after 2 seconds, the monkey has to touch a key either on the right or on the left, okay? So this is very, very simple. Up to now, every student in the Hebrew University can do it. Still, we make it a little bit more complicated, and we have different kind of cues. And the cues tell the monkeys what is the probability that you will get reward if you will do the correct action, okay? So now it's coming really to real life, because if the monkeys see this kind of reward, then you know that this monkey knows that if you will do the correct action, there is probability one that you will get reward. But in real life, you know it's never like this, okay? It's never like this that every correct action that you will do, you will get immediate reward, okay? Actually, real life are more like the other extreme, that probability of 0.25, that is 1 out of 4 correct action, you will get reward, okay? And still, you are ready to do it, okay? What is the chance that, what is your small goal of life? To be parliament member, to change the world, to bring peace to the world? What is the probability that you will do it? You know that the probability is very, very small, and still you are trying because there is some chance, okay? So the monkey learned this kind of probability, and the nice feature that we see that when we look at the response of the cell, then the dopamine cell responds with small elevation of their discharge rate when they see the cue that tells them that the probability that you will get the reward is small. And there is much bigger increase when they see the cue that tells them the probability that you'll get the cue, that you'll get the reward is high. Okay, 1 minute. This does not say anything that the monkey indeed use prediction error, okay? Because this says that monkey like reward, you like chocolate, okay? Whenever I promise you that there will be a chocolate at the end of the school, you are happy, okay? That is. But you can see that this is really prediction error, because what happens when the actual chocolate or actual reward is coming, okay? And here you may see that this was the response to the cue that tell the monkey there is probability 1 that you will get reward, okay? But now, 2 seconds later, the reward arrives. And the response to the reward that arrives after a cue that tell the monkey that there is high probability that you will get it is very, very small, where the surprising reward, the dopamine neuron react in much bigger way. So this is for us, and we have other proof to show that indeed dopamine neuron do not encode the hedonic, the pleasure value of the outcome. They give you the prediction error. They give you the difference between your prediction of pleasure and reality. Okay? So
about the measurement of the dopaminergic activity, is it general in the brain or in specific areas that highly correlated with rewards, like the mesolimbic pathway?
The answer in biology is never black and white, but it is more close to be to the answer with the specific mesolimbic pathway. Okay, this is so these are the dopaminergic neurons that encode the mismatch between prediction and reality, and I will skip it just to save time and to say, okay, so we have our model of machine learning. This model says that okay, we have the agent has the critic that calculate the mismatch between prediction and reality, and as the actor that make the mapping between the state and the action, okay? And we can now replace it with our biology, because what we can do is to replace the critic with the dopaminergic neuron that project to the input stage of the basal ganglia. Never mind, Kate, about where are the basal ganglia, part of our brain, okay, that we care about it. So, and they calculate this pleasure prediction error, and we have the actor, which is this loop that starts with all area of the cortex that give you the present state. You hear, you see, you have your memory, and you do action, okay? And so this is the actor part of the loop. So we have this in the basal ganglia. Indeed, this loop of reinforcement learning. And what I'm trying to say is that indeed in our brain, the basal ganglia network solves this problem of interacting with environment with noisy, delayed, and non-perfect feedback, and still giving us a behavioral policy that will end in maximization of the cumulative dopamine. And what I'm trying to tell you now, that the trick that biology has done to you, okay? So I started with the first thing that was, okay, your goal of life is to move forward your gene. In order to do it, you should go for the primary reward. Food, sexual partner, avoid lying, okay? But I did show you, I hope so, that there are problems with this tactic to go for the primary reward, because then you might stuck with the first sexual partner and so on and so on. So the trick that biology has done to you is that you are not working for the primary reward. You are working for the dopamine, okay? And the dopamine do not encode the hedonic, the pleasure error. It encodes the difference between prediction and reality, okay? And therefore, you are smart enough, okay? And you know, okay, it could be that I should pay this price in order, and because this is already predicted, okay, you are working for the idea of dopamine, okay? So the second thing that I've done, okay, so I start with moving to the gene. Now we are working for dopamine, your goal of life of dopamine. And of course, you might ask, okay, this is nice, it is thinking provoking and so on and so on, but we are more complicated than that we would believe that all our goal of life, all our behavior is shaped by this desire to increase the cumulative amount of dopamine in our brain, okay? I hope that at least some of you think that you are a little bit more multidimensional than this unidimensional dopamine, okay? And you may see those of you that know chemistry, this is the molecule of dopamine, okay? Very, very simple molecule, okay? So and still I would like to say no, okay? This is a very, very good first order approximation of every biological creature behavior, okay? And the reason that I'm saying is that because we know that elevation of dopamine is the final common pathway of almost all drug of abuse, okay? So clearly cocaine and cocaine, speed, and this drug are working directly on the dopamine system. Many people claim that the opiate drug of abuse also increase dopamine, and I'm sure that you have been reading about this electrical self-stimulation. So in rodent, we can locate the pleasure center in the brain. We can insert electrode to the pleasure center in the brain of the rat, and the rat is allowed now to press a key, and whenever she presses a key, there is electrical current going to the pleasure center in the brain, and this rat will stop everything. They will stop going for food, will stop going for sex and other things. They will just press the key till they will die or will stop the current, okay? So, and eventually, this pleasure center is the center of the dopaminergic neuron, okay? So actually, by pressing the key, this rat release more dopamine, as I said. It is not only this, it is, there are many, many other diseases, human diseases, that are strongly related to the dopamine system. One of them, do you know the diseases that are related to the dopamine system? So, schizophrenia is on one side, and on the other side is Parkinson, okay? So Parkinson is a disease wherein we are losing our dopaminergic cell, okay? And we'll see Parkinson, okay? And schizophrenia might be, again, it is more complicated, but might be a disease that we have too much dopamine, okay? And so my answer is indeed, okay, dopamine is the major, there are other players, and of course, but for a first order approximation, I think that we can live with this assumption that your drive in life is to maximize the amount of dopamine in your brain. So the question that I'm now trying to say, to continue to, I should, Karen, when I should be done? The hour. It's 4? Okay, so it's... Yeah. Okay. The question that, let's take a small break. Is it okay? You followed the main logic up to now, okay? So I'll continue with the logic, okay? And the logic is now, okay, let's see what happened to human patients that lose their dopaminergic neuron, okay? And we know that, about 1% of the population lose their dopaminergic neuron. This is staining for dopaminergic neuron in the area of the brain, and you may see that in the normal, this is normal monkey, but it is also in the human. They are located in an area called the substantia nigra pars compacta, never mind the name, and they project to the input stage of the basal ganglia at the striatum. But in the Parkinsonian state, we lose this dopaminergic neuron. Okay? We lose this dopaminergic neuron, and as I said, this is a very, very common disease. About 1%, about 3 out of every 1,000 people in the total population. It usually starts at the age of 60, but the frequency increases with age. So actually, when we are speaking about the older population, we say that it is more than 1%. And therefore, I'm quite sure that everybody of you have seen a patient who is Parkinson, either in his neighborhood or in his family. And still, in order to show it, I'll show movies. And I'll show movies of patients that volunteer to be photographed in order to actually to make you more understanding and maybe moving to help them in some time in the future. Please respect the patient. Sorry. Okay, so what we'll see over here is 67 old ladies with 7 years of Parkinson's disease. Most people are attracted by the tremor. Tremor is the most external dominant feature, and you see the tremor of the patient, and of course, actually, what I would like you to pay more attention is to akinesia, to the lack of voluntary movement. Look of the face of this lady, okay? The face are frozen, okay? We call it lizard face, okay? Because usually even their blinking rate is reduced, okay? So the face are frozen. Now we ask her to step out of the chair, and you see how much problem she has getting out of the chair. This problem of akinesia, which is very, very common to most neurological disease, okay, can lead to situation where these people will not look for food. They lose their internal drive to behave. This is it is not that they are not paralyzed, and still they don't have any internal vigor to move, to behave, to do whatever you are doing in every life. And this is very, very common. This is common in Parkinson's disease. It is very common. It is the major negative sign or symptom of schizophrenia, and in most other disease. So we are all the time dealing with this lack of internal drive when we are facing a situation with loss of dopaminergic neuron. So this is the one patient with Parkinson, and as I said, we see many patients like this. And the disease was described almost 200 years ago by James Parkinson, and still the big breakthrough in the treatment of this disease happened in the 90s, let's say in the 70s. About 40 years ago, when it was discovered that, okay, this patient need dopamine, they are lacking their dopamine neuron, we can give them back dopamine. We cannot give dopamine because dopamine do not cross the blood-brain barrier, so we give L-DOPA. Okay, L-DOPA crossed the blood-brain barrier and then being converted to dopamine. And again, there is a very beautiful book and movies by Oliver Sacks named The Awakening. I strongly recommend the movies. It is not Oliver Sacks that found the dopamine, okay? Don't be misled. It is this guy named George Kodiak that disappeared because he was a Greek person living in New York, so nobody mentioned his name. But you might be led to the idea that he's Oliver Sacks. He's a very, very good writer, not so big scientist. And since then, since the 70s, it is the gold standard in our treatment of dopamine of Parkinson's patient is by dopamine replacement therapy, which is very, very good and really help us for on average for the first 10 years of the treatment. So if you see over here time from symptoms onset, 5, 10, 15 years, okay? And over here, the patient with complication, you may see that by 10 years, most of our patients have complication of the therapy. And the complication of the therapy are that we are moving from the akinetic, from the situation that the patient will not move, will be akinetic, will be frozen. We are moving to a situation where the patient is dyskinetic. He is having too much involuntary movement. So again, this is a patient that just took her dopamine replacement therapy. Without the treatment, she was completely akinetic and not moving, okay? With the treatment, she has too much involuntary movement, uncontrolled movement. Still, the patient prefers this situation than the other situation, but we are in problem, okay? Because some of our patients start to develop their Parkinson's disease at the age of 40. So they are coming to this situation of dyskinesia at the age of 50. the lifespans of our population in the West is getting more. So if the average age of onset is 60, we need to find treatment for the people that already arrive to this stage with dyskinesia. So the next stage in our understanding of the story of Parkinson's disease came from the United States, and this happened in about 10 years after the discovery of the dopamine replacement therapy. And the story was going like this, that to emergency room in California, young people with severe arrived dozens of young people with severe Parkinson's disease. And as I said, Parkinson's disease might start at the age of 40, but it is very uncommon to see it at the age of 10 to 20, okay? Or 20 to 30 as this patient, and clearly not in a big number. It was a kind like of a detective story that at the end of it, it was found that all these people were drug abusers and were trying to use synthetic heroin. And unfortunately, this synthetic heroin contained some amount of a neurotoxin that we know today, and this neurotoxin is called today MPTP, okay? And this MPTP, when it is injected, unfortunately, to this human being by themselves or by us to monkey, kill all the dopaminergic cell and create a situation of Parkinson's disease. And indeed, actually, so this unfortunate event to this human being was immediately taken to the laboratory where we can inject MPTP to the monkey, create a situation of Parkinson's disease, and now learn what changes are happening in the activity in their brain before and after the induction of Parkinson's disease. So this is something that we can never do in human being, okay? I'm going to take a side track in a few minutes speaking about why you should support animal experiment, okay? But I would like to show now, okay, to make it clear that this kind of experiment can never be done in human patient because we never have in a human patient the situation that will put electrode in his brain in the normal situation, okay? So monkey were treated with the MPTP neurotoxin. We created Parkinson's disease in this monkey. We've noticed that there is some structure in the basal ganglia, this part of the actor that we spoke about it, which is overactive in the Parkinsonian state. And therefore, we've tried to inactivate, to reduce the overactivity in this small structure that is called the subthalamic nucleus. And indeed, what we found that this is the amount of movement normal monkey is doing. After MPTP, the monkey is Parkinsonian, is not moving, is akinetic. And after inactivation of the subthalamic nucleus, he returned to normal movement. No tremor in the normal monkey, a lot of tremor in the MPTP monkey, and then inactivation of the subthalamic nucleus, the tremor is reduced. Okay, yeah. Yes.
Is whether the Parkinson induced by MPTP can be cured by dopamine?
So let's start. Of course, the Parkinson induced by MPTP can be cured by dopamine, okay?
No,
L-DOPA? L-DOPA, yeah, by L-DOPA, yeah. It can be cured. It will be better cured. It depends because for L-DOPA, you need some kind of remaining dopaminergic neuron. So, but we can treat with dopamine agonists, the bromocriptine. We have direct dopamine agonists that are working on the receptors, and this work very fine in MPTP monkey like in human patient. Regarding the question if it is only target the dopaminergic neuron, no. It targets also other catecholamine system, very like what we see in human patient, okay? So it's really very, very good replica or very, very good model of the human disease. But again, to make things simple, I'm speaking about it, okay? So this was published in 1990, and then 3 years later, it was took to the human operating room. And we have this patient now with advanced Parkinson's disease, and this patient with advanced Parkinson's disease that we cannot help them anymore with dopamine replacement therapy because they have this dyskinesia. What we are doing now since 1993, we locate their subthalamic nucleus using advanced MRI imaging and so on. We locate their subthalamic nucleus in the brain. We put electrode in the WEC patient, we make a small hole in the skull, put electrodes that go all the way up to the subthalamic nucleus, locate the subthalamic nucleus by its activity, and put what we call deep brain stimulation pacemaker, which is located over here, and by this stimulation inactivate the subthalamic nucleus. And indeed, since 1903, such treatment have been carried in more than 90,000 patients all over the world. It became part of the Israeli basket, health insurance basket 6 years ago. And in Hadassah, we are having a program, and up to now, we've been operating more than 250 patients. Okay, so this is, meanwhile, this is the only approved surgical technique for human patient with Parkinson's disease. And again, probably you have noticed that I'm showing all the time movies with the title Best Typical, okay? Because, and clearly the movie that I'm going to show now is the best typical American movie, but it is not far away from the situation that we see in many, many cases. So, so again, we'll start with a patient having Parkinson's disease that you already know, okay? And you see the tremor of the patient, you see the mask face, you see the shuffling gait with very, very small steps that is not the tremor of the end. Okay, the major problem when turning around. And again, the same patient after deep brain stimulation, this is the patient, okay, if you have not recognized, okay. So after deep brain stimulation, pacemaker over here, and okay, as I said, best typical. It is American movies, okay. It is not as good as always, but still, I think the point is that this treatment has been approved and is now being done in Hadassah almost every week. We are doing it in other hospitals in Israel. In Israel also they are starting program. This is the only current program, only treatment that we have today for patients with advanced stage of Parkinson's disease. Yes. I will put it this way. Not after medication ceases working, we now recommend the patient to come to the surgery when medication do not give them the quality of life they need to. Okay? We are so confident now with the surgery, we tell the patient, don't wait to the time that your family will leave you or you will be forced out of your job. In the moment that drugs do not enable you full quality of life, come to the surgery.
Why doesn't it replace the drugs?
Because it is a surgery, okay? And we should be careful with surgery. Surgery is on risk, like bleeding, infection. So whenever we are able to treat a patient with drug, it is better to drug. But we know, and the patient knows that they have the option when the drug will stop do the work, okay? And yeah. Okay, so it is been used and approved, not as experimental treatment for dystonia, which is a kind of movement disorder and essential tremor. It is now, there is ongoing trials that we are part of it, the international trial of using it for major depression. That is depression which is refractory for antidepressive treatment and even ECT. And I will come to the dream in the future, to the dream future. Yeah.
What we had seen in the movie is a patient that went through the surgery.
Yes.
And is it a one-time?
It
has to go through one surgery.
One-time procedure.
Well, I'll put it this way. The patient has, if everything is going fine, okay, then it is one procedure. That is, the patient is coming. It is usually, in Israel, it is 3-day procedure. In the United States, it is 1-day procedure, okay? The patient is coming and going out, okay? Then still we have the advantage of having the pacemaker located over here that we can adjust the parameter. So we can adjust the parameter because this is not a cure for the disease. Okay, the cure for the disease will be the regeneration of the dopaminergic cell. Okay, this we are unable to do. So we offer some kind of overcoming or bypassing the real process of the disease, and therefore the patient is usually coming to the neurologic clinic every 3 months, and the parameter of the stimulation are adjusted according to the patient need. Okay, but the procedure is one time. The battery. Current technology battery work for 4 or 5 years, but then the replacement of the battery is a very minor surgery. It is a local anesthetic here in the chest. Okay, you don't have to replace all the wire; you just replace the battery. Okay, so but just 1 minute again. I would like to push it because I'm coming to Mount Scopus, okay? And I think it is very, very important to raise the issue of experiment on monkeys, okay? Because if you will open the website on my name, you will see that I'm called Dr. Mengele and so on, because I'm abusing and I'm torturing, touching monkeys and so on, okay? And I think that we as human being, okay, that understand a little bit, we have to understand that there is no black and white answer. Of course, it will be nice that someone will give us the information and tell us how to cure human being, okay? This is not doable, okay? We don't have anybody that tell us how to cure human being that suffer for many diseases, okay? And on the other end, okay, if we'll not allow experiment on monkey, someone will do this experiment on human being. And it will do it on human being probably in South America or in South Africa, okay? But not in Jerusalem, not in Boston, okay? And therefore, it is very nice to say that every person, every animal has the right not to suffer. I completely agree with it, okay? But I think that people like me, what we are saying is that there is evolutionary ladder, okay? And there is still a difference, okay? And if we can reduce the suffering of human beings that are aware of their suffer, okay? And I will come back to this point that I think that makes the difference between us and all other animals on our globe, which is our self-awareness and our understanding of, or our ability to be aware of the fact that we suffer and die, okay? It is not that I'm saying that monkeys do not suffer, okay? Monkeys suffer, okay? But their awareness is smaller than us as a human. We have to make hard decision, okay? And it is not easy decision, okay? And of course, this hard decision should be controlled by the ethical rules that say 3R. Reduce species, that is, if you are able to do experiment on monkey, don't do it on human. If you are able to do it on cat, don't do it on monkey. If you are able to do it on rodent, don't do it on cat. If you are able to do it on tissue culture, don't do it on rodent, on rat, okay? So reduce species, okay? But if you are unable to reduce species, then you go to the reduced number and the reduced suffer, okay? And taking this, again, we are not allowed to say we don't ignore the fact, because if we ignore the fact, someone will do this experiment on other human being, okay? And therefore, I think that we as society, okay, and this is what is going today in the United Kingdom and the United States, that people are pushed out and the experiment on animal are done in other, I was starting to say in the name of country, I will not say to be politically correct because I'm recorded, but in other countries that are not part of the West, okay? And clearly people care less about animal rights in these countries or on human, okay? And therefore, I think that, again, it's never, the only thing that I'm trying to convince you is that it is not black and white. Okay? It is not black and white. The situation is complicated, and not everybody that is making experiment on monkeys is someone that enjoy the suffering of animal.
When you are performing experiment on a monkey, is he pre-medicated with anesthetic agents, or is he fully awake?
Again, it depends. It depends. And as I said, part of the rule is reduce suffer, okay? So the point is to reduce, I say 3 R's, reduce species, reduce suffer, reduce number. Reduce suffer is to pre-medicate whenever you are able to pre-medicate. It is not that I'm trying to say that there are never suffer, okay? But I'm trying to minimize the suffering. Okay, let's go on because I'm aware that my timing is running. And the question is, of course, can we improve deep brain stimulation today in 2010? So we record also this electrical activity that we record now, that we recorded in the monkey, we record it now in the human, because in the Parkinsonian human. And in the Parkinsonian human, from time to time, or many times, we see oscillatory periodic activity of their subthalamic neuron when we are coming to the subthalamic nucleus of this patient. We can make some kind of formal calculation of this, and I will not go to it, okay? But if we can detect the amount of oscillation, okay, this is this black-red over here. So this is one patient with small area of oscillation, medium area, and bigger area. And if we plot over here the length of the oscillatory area, so this patient will be here, and this patient will be here, and this is the success of our operation, we see a very nice linear regression. For us, it tells us, first of all, it is operative. That is, if in the operating room we see only small area of oscillation, we look for a better location to put the electrode. But moreover, this tells us that this is the signature of the disease, this oscillatory area, and this is what we are trying to reduce with our deep brain stimulation. And therefore, coming back to the lab, what we are trying to do is indeed to create the next generation of deep brain stimulation. So today, deep brain stimulation, we put the pacemaker over here, and as I mentioned, the patient is coming every 3 months to the clinic, and we adjust the parameter. But this is not the situation in thermostat, at least in normal pace. I'm not sure about Mount Scopius, that the thermostat, you say, I would like the temperature to be over here 24. We have a sensor, and if it changes from 24, then we operate the cooling or the heating system, okay? So we call it a closed loop system, okay? A system that measures the outcome and operate according to it. This is what we are trying to do today in the laboratory. And in Parkinsonian monkey, we have recently succeeded to do it in 2 monkeys. And again, this is the amount of movement the monkey was doing before any treatment. This is the amount of movement the monkey was doing with the typical treatment that we give today to our patient. And this is the closed loop. This is many control, I will leave it. But the point is that we can move to the next generation. So coming to the end, at least from our point of view, what we are trying to say now today is that we would like to try to convince the industry to go for this idea of closed loop, automatic adaptive system, also in Parkinson patients. But then the question is, can we do it also in other diseases of the brain? And from my point of view, the disease that the main disease that we as society ignore today is schizophrenia. Schizophrenia is a disease that starts at the age of 20, 25, 1% of the population. We don't put them anymore in physical prison, we put them in chemical prison, our society, your society, okay? And we put them in hostels, okay, under severe antipsychotic treatment, okay? They don't move in the street, okay? We are better than the United States. In the United States, they are just outside in the street, at least in our place, and they are in hostels, okay? But still, we don't bring them back to society. And the question that people like me are asking, can we use this trick of closed-loop DBS also in order to cure schizophrenia? And this is something that to do it, we have to develop monkey model of schizophrenia. We have to test it because, again, everything, at least from my point of view, should start with solid science and only then be tried on human beings. I have only one final slide, and then we'll be able to have discussion, because this is final to summarize everything, and actually to come back to. So I started with the question that what are the goals of your life, okay? And I hope that at least I convince some of you that the goal of your life should be move to biology and medicine and find the cure to severe brain disease, okay? So this is a possibility, but what I was trying to say in the meantime, that biology goal, from my point of view, were to move your gene to the next generation, and then I said, okay, but we have a problem with this, so maximize the cumulative amount of your dopamine. And again, as I said, I really hope that most of you are offended by this naive saying of your goal of life. And I would like to say that we as humans are lucky because we have a loophole in the system. Because biology gives us the tool, first of all, that we spoke about a lot. The trade-off between short-term small or even negative income for future cumulative bigger income. But what biology gives us more, and really over here I'm completely speculating, biology gives us, as human being, it gives us language, consciousness, and self-awareness, okay? And I think that, I'm quite sure it is related, okay? So therefore I think that other animals that don't have language, they have communication, at least in our society, but they don't have language, don't have self-awareness and don't have consciousness. So biology gave us, as humans, the ability to think about our doing, to shape our behavioral policy. What I'm trying to say is that at every point of your life, actually, if I'm staying over here, then nobody should be penalized for his doing, okay? Yigal Amir just act according to his biology. What is my right to say to someone, you are immoral by your doing, okay? And this is indeed the case. I'm not saying to a dog or to a monkey, anything of your action are immoral, because dog, monkey, and some of our psychotic patients are not aware, they don't have this gift of language consciousness and self-awareness, but you have it, okay? And therefore, what you can do is to use this in order to modify your behavioral policy in order to do something good, as I said, maybe to cure brain disease. So this is the end, and he was first, just to be fair.
You spoke about deep brain stimulation for in the context of schizophrenia. Let's say psychotic disturbances, general. But as far as I know, psychotic disturbances is an outcome of overstimulation of the subtype of dopaminergic 2 receptors. So how can it?
Deep brain stimulation, the main action of deep brain stimulation device is to inactivate overactive area. Okay, this is the way the reason is complicated. We call it deep brain stimulation because we stimulate, but probably by this stimulation we are leading either to polarization block or to inactivation, and therefore deep brain stimulation mimic inactivation. And therefore, I think the issue is that indeed we are able to inactivate overactive area using this technique, okay? But again, I would like to put it in a frame. I'm speaking about the possibility that need a lot of research of using deep brain stimulation in order to treat this kind of disease.
Can you explain how the loop works? What is the what is the goal of this loop?
This loop. Yeah. This loop is just, we put electrode in the brain of the Parkinsonian monkey. We detect the oscillation. Whenever we detect the oscillation, we stimulate. Whenever there is no oscillation, we don't stimulate. It's very simple, okay? And of course, it could be more and more sophisticated, but at the present state, it is like the thermostat. Whenever the temperature is different from what we are setting, then we operate the cooling system. So this is the way that we do. We believe that oscillations are abnormal phenomena. Whenever we detect it, we stimulate. Very simple. So thank you for your attention. Sorry for taking so much time.